Showtime. Hi, I'm your host, Marsha Florence for Just Ask. Well, ladies and gentlemen, thank you for tuning in as usual. I enjoy seeing each and every one of you or reading your feedback about Just Ask Talk Show. And it's a wonderful thing to know that even though we're not in the studio, we can still bring you the wonderful quality shows that you're used to. So without further ado, today we have a company called Comfort Keepers. And Comfort Keepers liaison, JoAnne Darga, is going to fill us in on some resources and information for senior care and disabled persons, especially for those of you who are homebound. We need to know who's out there and what services are available to us. So without further ado, as I was trying to say the first time, welcome JoAnne Darga, liaison for Comfort Keepers. Good morning, JoAnne.
Good morning. It's wonderful to be with you, Marsha. I wish we were together, but this is the next best thing. And at least we don't have to have masks on because...
No, we don't. Okay. Well, thank you for joining us. And I'm impressed with the story behind Comfort Keepers. So could you first start off, tell us a little bit about yourself as the liaison and Comfort Keepers?
Okay. Well, I've been with Comfort Keepers for 8 years now, and I work for two very nice women named Jean Trumpy and Sarah Webb, their mother and daughter, and they started the agency 16 years ago, but actually the company as a whole was started by a visiting nurse in Dayton, Ohio, over 20 years ago. So we've really grown. We're an international franchise now. I came from the world of sales and marketing. This was something new to learn about home care, but I've learned a lot in these 8 years so far.
Okay, now tell us now, you said this is a franchise. So what is the catchment areas that you guys service and where's the other areas?
Well, we're based in Plymouth, what they call the quaint old village of Plymouth. And, but we cover a lot of Western Wayne County, Plymouth, Canton, Westland, City of Wayne, Garden City, Dearborn Heights, Dearborn, Plymouth, Livonia, and Redford. But there's also sister offices nearby. So if people contact me, if I can't help them, I can connect them with our sister offices. So there's plenty of coverage.
Okay, and that will be someone's concern. Like, oh, I like the services, sound great. Where are they? How can I get them to my area? So by it being a franchise, there's other locations that can be referred.
Right, and they can call me for guidance, or you will be at one point seeing our website on the screen, and comfortkeepers.com has a locator box where you can put in a city or a zip code. It takes you right to the office that covers that area.
Okay, now that's great. Okay, now, so as a liaison, what is your role as a liaison for Comfort Keepers?
Well, that's a big question. I do a lot of different things. I represent the company in the community. We belong to 5 chambers of commerce. So I have ways that I participate in activities, golf outings and networking groups and health fairs. Of course, some of those are restricted right now, but in better times, I'm out and about a lot. But I also get drawn into direct client care, not that I'm a caregiver, but that I, would do the initial home assessment visits and help to kind of put the pieces of the case together, introduce the caregiver the first time they go to meet with their client, make sure that they know what's expected of them, and make friends with the family. It's a very personal, intimate kind of work.
And so you're the person that actually gets to tell the client what type of services are available through Comfort Keeper.
Okay. And we talk to them about what their needs are. So the assessment is a two-way street. Mm-hmm. Me and our company, and I'm assessing their home and what their needs are, making suggestions. We develop a plan of care that makes sense as far as what we're going to be doing, chores or personal care, and then also, you know, the time frame too.
Okay. Well, a lot of times, people are uncertain of what type of services they need when, they're becoming of frail nature, or if they have a disabled adult child or something of that nature. So do you guys have an age criteria that you cover, that you care for?
18 years of age. We can help anyone over 18 years. And I think we do mostly, we're caring for elderly people. But we have had a few people call us for, you know, adult folks too. So we can do either or. And what we do, okay, sometimes people are uncertain about that, or they'll call us for one specific thing. And I do like to explain to them the breadth of what we can do. So it's almost like two different categories. One would be anything to do around the house, almost like what your daughter would do for you if she didn't have her own life to live. Housekeeping, light housekeeping, that is. We don't do windows.
Okay. Okay.
And no outdoor maintenance. But housekeeping, laundry, anything to do with meals. But then also medication reminders and transportation to the doctor's office, or maybe somewhere more fun than that, if whatever the senior wants to do or our client wants to do. And then the other category would relate to hands-on personal care. So that would be safety in the shower, or if you can't get in the shower anymore, even a bath right in your bed, and managing, you know, bathroom issues, all kinds of personal hygiene issues. And then beyond that, I do like to stress the idea of companionship, because that's always included and it's more important than ever. If you think about how isolated we've all been during this period of time, you know, for a lot of seniors or homebound folks, that's their daily life. And social isolation and loneliness, there's a lot of research and talk about that lately, that it's detrimental to health. You know?
So you guys are essential workers.
We are.
Okay. Okay.
We are definitely.
And so with that means you guys are prepared to go into the homes with your gloves, your mask, whatever is required.
We have all the PPE that we need. There was a little bit of a struggle in the early days to get a hold of it, but now we're very well stocked, and we're following all the protocols that are recommended to keep people safe and healthy.
Okay. All right. Now, a lot of times, JoAnne, we could talk about what people need, but people are always concerned about level of pay. Okay. Do you guys provide any options so far as like how this is covered?
Well, I think I'll use this as a little educational moment right now, because a lot of people ask that question even when they first call me. They're expecting Medicare to cover it. There's really 3 different kinds of home care. One is called skilled nursing in the home. That's a visiting nurse, social worker, physical therapist, occupational therapist, and even an aide to help with the personal hygiene. That is covered by insurance, but it's limited by a certain period of time. But there's a prescription written by the doctor. You can't just get it by calling. Then there's hospice home care, which would be similar types of people coming into the home. And again, paid for by insurance, but limited. We are the 3rd category. It's often called private duty home care, because it's typically done in a private home. Sometimes we're invited into a residential community where they need some one-on-one care for their loved one. But so private homes and private pay. It's mostly private pay, except there's a few times when insurance kicks in, and that would be auto insurance after an accident. Also long-term care insurance, which is kind of a specialty product that not a lot of people even know about, but it's a good thing to help in these situations where you need assistance with the activities of daily living, medical, but certainly impacting health. And sometimes there's nonprofit organizations, like, for instance, we care for a gentleman who has ALS, and we are connected with that family through the ALS organization.
Okay. Great.
Other than that, it's private pay. it's affordable, reasonable,
Mhm.
especially if you compare it to the cost of moving into assisted living. There's definitely a cost there too. So,
You know, I think a lot of times people are intimidated by the fact that if it's an out of pocket cost, but really, when you're taking care of yourself and you need help, there is no getting around paying something or paying someone. So
right,
my thing is always, if you've worked and earned your living, or if you're getting assistance from the government, that money is to be used for your care, and your
right.
care is so important that,
Mhm.
you know, to have someone be able to take you to and from your doctors, have someone to help prepare your meals, have someone to assist you when you're bathing,
Right.
to make sure you don't slip and fall, help someone to help you with your grooming. To me, that's what money, in other words, is for. Okay, income is to help me take care of myself when I'm at a point that I can no longer do it myself. Okay, so we should come out of the category of, oh, that's too much, oh no, I can't believe that. Well, if you don't have children, then this is what you do. And if you do have children, where are they? Okay, so if they're
Yeah.
not around, right, if they're not around and you don't have too many choices, you need to connect with the agencies such as Comfort Keepers
Right.
and do something to let yourself maintain being active.
Active and somewhat independent. These communities where people can move, the residential places, some of them, they're beautiful and they have a built-in social life. That's a nice thing. But mostly the seniors would rather stay in their home that they're accustomed to as long as possible. So,
Right.
and sometimes we're just a transition. You know, we're going to help you stay safe and happy at home until you are ready to make that move. And when it's time to make that move, we'll come and help you sort things out and pack your boxes. And
Thank
glad
you.
you mentioned about the families, because I mean, nowadays that women are working, a lot of people are in that sandwich generation where they're helping their senior loved one, but they're still raising their children too. So those folks, I mean, they're they're really overburdened.
Right.
So we can, I like to say we support the whole family in that way, that we're providing respite for them. And even if they are totally motivated, they want to help. But how about if we come and do the laundry and clean the bathroom and let the daughters and the grandchildren come and just visit and just
Right.
enjoy quality time instead of arriving with a list of chores to do. Right?
Right. Right. And
That's another way that
it
we
should be
help.
broken up. I mean, you know, if someone's there to help and care of the home, but the family members want to enjoy the comfort of their loved one,
Yeah.
they should incorporate that. I mean, I don't see what the problem is, but you know, some people are like, well, I can do it myself. You could if you wasn't tired, okay? You
Right.
could if you didn't live 100 miles away, you know.
Right.
So there's things that you can't do, but you want to see your loved ones, you know, live a long, healthy life.
Right.
Incorporate a program such as Comfort Keeper in your plan, and
Mhm.
that's to me, that's the plus. That's the plus. I know I didn't want to go too far off, but I know you guys have a event, so we have a photo, and I wanted you to tell us a little bit about the photo we're getting ready to see.
Mhm.
What's this event called right here with the two gentlemen in the car?
Well, back in June, we celebrated our second annual Day of Joy. And, you know, last year we did it more focused on the caregivers. We had an event where they dressed up funny. We had prizes, we had lunch, we had a training session. But this year we decided to extend it to our clients because
Hmm.
they have been isolated at home in many cases. So we wanted to actually visit, wearing our masks, of course, but we delivered bouquets of fresh flowers to every one of our clients to their home. And there was around 70 homes.
Okay.
And we brought our caregivers into the fun of it, the joy of it, where they delivered them to their client. And then we kind of had some prizes and drawings to
So
bring them some joy too.
the photo right here with the two ladies. I mean, I was really touched by this. So those are the beautiful flowers that you all give to the clients.
Yes.
And I notice everybody has a mask on. That speaks volumes in itself.
Yeah. That's what we have to do nowadays. Sometimes we have even more elaborate PPE. You know, we do have gowns and shoe covers and shields, gloves, of course, but it depends on the case, you know, and what the family wants too. Mhm.
Okay.
So The Day of Joy is one day, actually it kind of spilled over to 3 because there was a lot of, I even got to do some of the deliveries myself because the caregivers sometimes are taking care of more than one person, or maybe they have a day off. So we made it all work out and it was wonderful. But we like to bring joy 365 days of the year. And all of those practical things we were talking about doing to help people, really the companionship and the bond is so important. In fact, a few years ago, our company kind of redesigned the logo and we changed our whole motto to be elevating the human spirit. Well, somebody does your laundry for you, that helps your spirit, right?
Mm-hmm.
So just the interaction and the engaging, a beautiful relationship develops between the caregiver and their client. And we really do become like part of the family.
I know we have a copy of that beautiful logo, so let me get them to let's see if we can bring that up. Right, and is that you guys' new logo?
No, this is just bringing up the attention to the fact that we've been around as of 2018. It was 20 years. So,
Oh, I'm sorry. Okay, so that's your anniversary tag. Okay, now that's even nice. So it's been 20 years.
20 years. And I think there's a lot of competition in what we do.
Okay.
We are one of the companies that have been around for a long time. And so we have a good history and experience and a good program. So yes, the 20 plus years is important.
That's impressive.
Yeah.
That's impressive in itself to give people opportunity to know that you're not new to the game. You've been in the game. Okay. Now I have a personal question. So some caregivers don't want the same sex to care for them. They like the opposite sex. But in case when a person calls and says, well, I need someone to look out for me, can they request a man? A man can request another man, like I'd rather have a male aide, or can a woman say, I'd rather have a female aide? Or, how does that work?
Well, that is something that is discussed sometimes on the phone, but more depth when we have the in-home assessment visit.
Okay.
The way there's no charge for that visit and no obligation. And I always let people know that we can come, we can talk it over better in person with them, even though I'm wearing a mask. Because and then they can decide, then they could sign up right away. If they're not ready, I leave the information, the printed materials, and they can think it over. But there's a lot of details if you really think about it. Gender, sometimes people, if there's 2 dogs in the house, I have to make sure that I let our scheduling team know some of our caregivers don't want to be around animals. Maybe they're allergic to cats. Maybe they can't stand if there's a smell of smoke in the home.
Okay.
So, and of course, availability, time of day, all of those things come into play. And those are all considered to make sure that the family is really happy with the plan that we've put together for them.
Okay, well, that's good to know. I mean, that's right off the top. We should know that automatically. Now, I'm going to put up our phone number because people may call JoAnne and ask one of those magical questions. So if they choose to call us at the Just Ask Talk Show, our number is 1-800-323-5336. Of course, they know they can email Marcia at Just Ask Talk Show, or Twitter, Just Ask Talk Show. So we always like to know if a person missed the show, they can always contact us. But you guys have a website and phone number. What is that?
Our main number that people can call is 734-397-1111. And if people remember me from the show and they want to speak with me directly, the office will put them in touch. I have a cell phone number too, but sometimes I'm busy being on TV or
Okay.
not available to take a call.
I'm sure the office number will do just fine. Okay. Now what is that site again? If they put in their zip code, what did you mention earlier? If they could put in their zip code?
Very simple, comfortkeepers.com. And when they'll see it right away, like on Google, it says, find a local office. They click on that, a locator box comes up. And once they put in the city or the zip code, that will take them directly to the office that is closest to them.
Okay. Now I was reading in my notes something about elevating the human spirit.
Yes.
And is that what all the things that you guys do to keep people, feeling live, feeling comfortable, feeling love, feeling compassion? Is there anything to that when you say elevating the human spirit?
Well, it's a pretty highfalutin sounding theme, but we feel like if the caregivers are introduced to that concept right from the first day they're interviewing, and our families are introduced to that phrase, it's part of our logo. Let's all strive to live up to the highest level. Even if we're there to cook dinner and do laundry, we're still a friend and a companion and a visitor and a friendly face, someone to share stories. Actually, we have another phrase, this kind of leads right into it, interactive caregiving. It's actually a trademarked phrase because we're not just coming there to babysit, so to speak, although sometimes that's what people are looking for, just someone to be there, not even to do any chores. That's a request sometimes.
Yeah, well, companionship, just to be in the presence of someone, to strike a conversation, helps the mind. It keeps the
It,
brain circulating. So, some people don't realize. Like, I noticed that people who play lottery, when they play lottery, when they do numbers every day, all day, their mind's still fresh because they're lottery players. Because
right.
they know figures, they know numbers. But some people say, "Why do you play numbers all the time?" Well, some things keep people moving if they do crossword puzzles and they read all the time. So certain things keep the mind active. And like you said, even if a person doesn't want any chores provided or anything, they just want companionship. That is the key element of keeping a person going.
Right. And I should say right now, I talked about taking a senior to their doctor appointment or somewhere more fun. We did get a request once to take them to the casino. We can't do
Okay.
that.
Okay.
But
Well,
other things, puzzles, puzzles, they seem like something simple, but it does test your mind. Playing cards, reading together, sometimes praying together comes into play.
right.
We're not a religious organization, but we'd like to find out what's important to the family and the client. And if praying is going to be something that works for both people, that can be done as well. And we've actually taken someone to visit a gravesite of their loved one,
Yeah.
anything that's going to appeal to their spirit. So, mentally stimulating, um, physically, let's go out and take a walk. As far as nutrition, hey, it's time for that lunch that we made, and don't forget to hydrate. That's something a lot of
Okay.
seniors forget to do. And emotional, give them a chance to talk about their families and their memories. Maybe the family has heard the stories over and over. Here's a fresh friend that will be happy to hear, what you have to say. And then laughter, of course. If we can help them to, have a giggle, whatever it takes, that's really helpful too. Laughter is the best medicine, they
Oh,
say.
yeah. Oh, yes, yes, yes.
So
Well,
interactive,
just like the method we're using now to communicate, Zoom, a lot of people will actually tune into the show, whether they see it on Facebook Live or if they see it on Channel 56 or any of our cable lineup. It's a wonderful thing to know that they can stay in touch with us here at Just Ask and
Mhm.
learn something about an agency such as Comfort Keepers, so that they can find out where a resource is and how to get in contact with that. And especially if they don't want to, if they have young children or adult children that live out of state and they say, I need some services for mom and dad and I just don't know what to do. That's where Just Ask comes into play at. And we just enjoy learning something about each and every agency and organization every time we, get a chance to, well, I get a chance to interview someone.
And I noticed that in the beginning of the show, when it flashes the different topics that you are focusing on. And I'd just like you to know that I have a lot of those resources under those categories, like legal and health. And I just get a real kick out of connecting people with the resources that they need, it beyond what we can do for them too, veterans benefits or elder law or caregiving support groups for family caregivers. I've met so many wonderful people in these past 8 years because I think in the caring professions, it draws a caring, loving hearted person. And so I've made a lot of wonderful friends and I'll be happy to help people connect with those resources too.
Well, that's great to know because I'm sure there's someone, yes, there's someone out there that's saying, I'm a veteran, I need some support, and they don't know that they can connect with somebody to get, some resources to find out if they're eligible for benefits, medical, medication waivers, legal services. They have no idea.
Right. And actually, the veterans benefit, I didn't mention this before, but there is a program called Aid in Attendance that is available for veterans who've served during wartime. It doesn't have to be that even they were injured, they don't even have to have been in the actual combat. It is a benefit that's called a pension, but it's not automatic like some pensions are. You have to actually apply for it, and it can benefit both the veteran himself or herself and the surviving spouse. And it's specifically for our type of home care, the non-medical assistance with activities of daily living versus the medical home care. So we can't fill out the form for them. It's an arduous process, but we do tell people about it. We do have some resources of people that can point them in the right direction, answer questions. So it's worth it to go through the application process.
Okay, well, I'm glad our viewers heard that from you straight, the liaison for Comfort Keeper. Well, JoAnne, will you come back and join us again? I mean, you gave us a wealth of information, and we really appreciate learning today about Comfort Keepers and yourself as the liaison, because the liaison knows everything. Okay.
A little bit. We don't know we can't do everything, but we know a little bit about everything.
That's the good part. And you know quite a bit. Okay. So please thank the director of Comfort Keepers and let them know we appreciate having you as our guest. And one more time, do you have a phone number that you want to give out for your location?
Yes, 734-397-1111. And then remember, comfortkeepers.com, very simple. That would eventually lead people to either to us or to the other office that's more close to them.
Okay. We'll post all that information. Okay, so people who are interested in looking for you. Now, once again, our guests may call and say, I just saw you on Just Ask Talk Show. So we look forward to the responses as well. Okay.
Well, thank you, Marcia. I'm so glad a mutual friend put us in touch. And I've really enjoyed getting to know you. And I'm going to keep in touch and maybe connect you with some other good resource folks. Okay.
Well, thank you. Look, the people in the community appreciate it. So anything that we can do to spearhead more information and resources for Michiganians, we enjoy doing that. Okay. All right. So, ladies and gentlemen, as always, you know who I am. I'm your host, Marsha Florence with Just Ask Talk Show. You know me, I don't like to leave a stone unturned. So we have to find out what resources are out here available throughout the community, as well as if it's beyond the state of Michigan, can we use it? Of course we can. So tune in next time to find out what we have on the who we have on the platform. But don't forget, if you miss it on Facebook, you could always catch us on Channel 56. All our cable stations, Comcast Detroit, Southfield, Birmingham, Bloomfield, Livonia, Redford, Novi, Troy, and Lansing. Okay, so you can't miss us. And always go to the Just Ask Talk Show website, justasktalkshow.org, and watch the show as well. I'm your host, Marsha Florence for Just Ask. And what do I always say? If you know a person with a disability or if you just have a general question, don't be afraid to ask. Just ask. I'm your host. Thank you.
Thank you.